This year, Rocky Mount celebrates 150 years of existence. This is the beginning of the coastal plains region within North Carolina. So the Tar River runs through Rocky Mount. At the falls of the Tar, there's a little step waterfall that's created. Well, that waterfall was an important place in the 1800s for Native Americans, for settlers that were coming here from Europe, as well as African slaves. And so this convergence of the trade, the tar trade, the tobacco trade, the cotton trade, in this particular area became the mainstay of this burgeoning economy, which unfortunately was based upon slave labor. I believe race is important in every single conversation, and to me, Americans, especially Southerners, run from the discussion of race, but how do you not think that race is important when since the 1600s, race has been a factor in the fabric and the shaping of this economy and this country and our perspective about people here and all around the world. So I look at it as an opportunity to change the conversation from a conversation that is uncomfortable, which it will create discomfort because we've had an uncomfortable history. We see the history of race in the working out of health disparities. When people present to us in our medical centers and they come because they haven't had opportunities to work in jobs that present a living wage, or they come because they've had negative experiences with law enforcement, and those negative experiences have translated into persistent historical and generational poverty. OIC is here to serve everybody regardless of what they have in their pocket to pay for.
So OIC serves about 8,000 patients, 24,000 visits a year. So my population and people I take care of has lots of social determinants of health that make it really difficult for them to get their health care and to maintain their health. So what we do to help take care of our community is provide lower cost health care. I don't think it's fair to say low cost in today's environment, but lower cost health care to people who otherwise would not have health care at all.
I am a MedServe fellow, which means that I am working at OIC Family Medical Center for 2 years, and I function in a few different roles, a lot of different roles. I graduated from Wake Forest last May, and I was pre-med, but before going off to medical school, I wanted to get some more experience in a clinic. The only work I had done was some volunteering and kind of sporadic things, and I wanted more experience, so I found MedServe. We had a guy come in, and his hemoglobin A1C, which is your average blood sugar for the last 3 months, it was really high. And the higher it is, the higher your chances of stroke or heart attack, or just, he's a diabetic and he was uncontrolled. And we realized that the reason he was uncontrolled was that because he wasn't taking his medicine, because he hadn't picked up his medicine from the pharmacy. Dr. Roberts had me call him to make sure he had picked up his medicines and that he was taking them. And so I think I called him 3, 4, maybe 5 weeks in a row, just, hey, did you pick up your medicine? Have you picked it up yet? Did you get a chance to pick it up? He's like, no, I'm gonna get it in a few days. I'm like, okay, I'll call you in a few days. I'll call you next week. Let me kind of be like an annoying bug in his ear, but he ended up picking it up after about a month of me calling. And at his next visit, probably a month or 2 out, his A1C had dropped from like an 11 to an 8, which is huge if you know anything about A1Cs. So I didn't really do all that much, but I mean, that could have just kept him from having a stroke. IBH, did you want to do something with Tania's specialty?
Yeah, because we haven't mentioned obesity yet, right?
Mm-hmm.
So yeah,
So my current experience with MedServe has been really awesome. I mean, we lucked up and we got Adelina, who is far beyond anything that I would have expected as an intern, as a student just coming out of college. Her maturity level and her work level is absolutely amazing. She helps more than you would ever know in quality improvement department and getting labs done and getting those things in order. She helps me with my newsletter as communication with the providers of what needs to be done. She takes notes for most of our meeting minutes. She actually helps me plan my schedule for the day, make sure the templates are done. She's learned a lot about diabetes and lab orders. She does health coaching. She's just helped more than you could possibly imagine, but she really helps on every front of the organization. Without Adelina, I just would not nearly be as efficient or sane. I wish everybody could have learned to use their MedServe intern as well as I've been able to use mine, because she totally makes my world and my life better at work. I think I make her insane though. She might have told you that.
I have been extremely amazed at the program, and especially the value that MedServe is going to bring to Adelina's career. She has had the opportunity to be exposed to the internal operations of a medical center, and a medical center that provides integrated health services. She's seen providers, doctors, mid-levels at work. She's seen them interface with pharmacists, interface with behavioral health clinicians, interface with dental staff. So, and also she's had the opportunity to work with the financial staff, the billing staff, the management staff. So when she eventually graduates from the MedServe program, I can only imagine the type of physician that she's going to be, because now she's seen it all. She would have seen both sides.
In between, since their offices are here and then their rooms are down there.
OIC is an education training organization. And so you have to understand from our very beginning, we've always prioritized and emphasized quality education to everyone. MedServe helps us to extend that vision to students who are pursuing careers in healthcare, especially for those folks who want to be doctors and locate in communities like ours that might be economically challenged but still have wonderful people who live here and futures that we want to see vibrant. Because we are a medically underserved area, our partnership with MedServe helps attract brilliant young professionals like Adelina to our community to give them a firsthand look at what it's like living in a rural community with challenges, but also with great opportunities.
A healthy American means a healthy America. But we got to get people to get out of the mindset that, well, these people, those people, no. It's we the people of these United States. And I think that the MedServe program is helping educate people who can become future advocates of the changes that are continuing to be needed to make this country better.
Well, actually, North Carolina has per capita more African American female physicians than any other place in the United States. Me being from Colorado, there's just not a lot of African American females, period, let alone physicians. I think sometimes we're still not necessarily seen as being at the top of our games in our careers. So you have to remind people a lot of what you do and who you serve, and you'll walk in a room and you'll say, hey, well, when's my doctor coming in the room? Well, I'm here. Would you like me to find another one?
I definitely see where, just from the patients that we serve, I guess they have a little more respect for me, or like we'll have little girls that come in and it's like, oh, she's like me. I think I'll have a better answer in about 10 years when I'm in my field, but I can definitely see that it's a big deal, especially around here.